All right, so our physical bodies heal, but healing itself is a biocultural process. Medical anthropologists specifically recognize four distinct therapeutic processes. The first is the clinical therapeutic process. This is the healing process in which medicines have some active ingredient that is assumed to address either the cause or the symptom of a disorder. So, taking ibuprofen for a headache, right? That would be a clinical process. We have symbolic therapeutic processes, healing processes that restructure the meaning of the symbols surrounding the illness, particularly during a ritual. So the trancing that we see from Gunda when the baby is ill in Nice Story of a Kung Woman, right? That's capitalizing upon symbolic therapeutic processes. We have the role of social support. The social support therapeutic process is a healing process that involves the patient's social networks, especially their close family members and friends, who typically surround the patient during an illness. And having social support absolutely plays a role in immunity. For one, it can lessen the work that you have to do, right? You're free to convalesce if you've got social support. You don't have to get up and work and take care of yourself. You've got other people doing that, which allows you to rest and recuperate. But it's also of incredible importance when we talk about mental health, right? And the role that social support can play in alleviating mental health concerns. And then we've got persuasion or the placebo effect. This is a healing process that works on persuading a patient that he or she has been given a powerful medicine, even though the medicine has no active chemical ingredient. And so this is where this belief in what can heal you can actually trigger a healing effect, right? This is why prayer works, for example. This is why people have found relief when given sugar pills versus like some clinical treatment. So, we often talk about the placebo effect in relation to clinical trials, for example. If both treatments work at the same rate, both the sugar pill and the actual treatment, then we know that the what was developed and being tested doesn't have a measurable therapeutic role. When we look at healing cross-culturally, we can find that different cultures focus on different therapeutic processes. So in Western medicine, we very much focus on the clinical processes. That has created, particularly as it relates to mental health issues, has created a larger and larger proportion of the population that seeks medical treatment, drug treatment specifically for mental health issues. Think about the proportion of the population that are on antidepressants, for example. More and more research is coming out that shows that while antidepressants may be helpful in the short term, that they create problems of addiction. And I'm not immune to this. I take psychiatric meds for my Tourette's and my OCD, and notice that if I've forgotten to take them for a couple of days, or like we had one time where we went to Europe, and the one thing that I forgot to bring were my prescription meds. I go through withdrawal symptoms, chills, tremors, cold sweats, all of that. So, it's something that you have to kind of weigh the costs and benefits for yourself in consultation with your family and your medical practitioners, right? Whether that's going to be the way that you treat mental health issues or not. But we recognize, so we're very much focused on clinical processes, whereas Indigenous populations may focus more on symbolic processes and social support. All right, so what can anthropology then contribute to addressing global health problems? So the themes of understanding and actively addressing global problems are key concerns of contemporary medical anthropology. Medical anthropologists have been increasingly proactive to improve healthcare in their research communities. That Tsimane project that I was talking about, for example, we briefly discussed when we were talking about the ethics of anthropology, but because the Tsimane Health and Wellness Project was focused on diagnosing and treating illnesses and disease in the Tsimane, you can't just, when you're done, pick up and leave them with no infrastructure, right? You can't just pick up and remove all of that healthcare that you've been providing when you're done with your field site. So it's an ethical obligation then of anthropologists to improve the public health of the populations that they're working with, to leave structures in place when they leave that allow further access to the healthcare that they've been providing. In the 1950s, medical anthropologists assisted with an early attempt to reduce infant mortality in Latin America through public health programs. Um, their goal was to encourage rural peasants to receive vaccination and other medical intervention at the clinics that they had proposed or that they had set up. And so you can't you can't just take that away when you leave. You've got to leave some system in place to maintain access to these public health programs. By the 1970s, the idea that certain global diseases could be eradicated by the year 2000 seemed justified, particularly with widespread vaccination, right? We did eradicate smallpox, except for 3 vials, only 2 of which that we know where they are. We almost eradicated measles, though measles has shown a resurgence in more recent years. Polio was on its way to being eradicated, though there still are some naturally occurring kind of hotspots for polio. But we've also had the introduction of new diseases, diseases like HIV and Ebola, and now coronavirus. So we've not only seen the reemergence of older diseases like measles. One interesting thing about measles, I've got some colleagues that found that the monkey jungles in Bali were harboring measles, that the macaques that are present in those monkey jungles were harboring measles and offering a vector in which measles could mutate, where it could potentially return to human populations in a more virulent strain, or at least a different enough strain that current vaccinations wouldn't have an effect on it. So in some cases, even though we think we're eradicating a disease, there can be hidden pockets where that disease can thrive and mutate. But we've also then had this emergence of new ideas or new diseases. HIV came to the forefront in the 1980s, right? And was initially thought a disease of moral depravity because it was so widespread in particularly gay men. Ebola was a real concern in 2014 when we had our first cases come to the United States. Ebola wasn't really a good. I mean, that was when we first maybe that most people kind of had their first taste of concerns about a pandemic. Ebola is not a good candidate for a pandemic because it's too lethal, kills 90% of its patients. It also requires hot, moist tropical environments to thrive. So Ebola wasn't our pandemic, and instead now we've got coronavirus. We in the United States have a large proportion of the population that believes that the coronavirus is a hoax. And this was all engineered by the World Health Organization, by Bill Gates and Microsoft as a means of introducing population control and as a way of um, reducing or erasing some of our constitutional freedoms, right? I mean, this is something we're still facing. It only just now were people able to convince Donald Trump to actually wear a mask. And now he's espousing masks as your patriotic duty. So we see a lot of, well, I mean, in light of the continuing global pandemic, we see the role that culture plays in identifying disease, identifying illness, and accepting treatment or control processes over these diseases and illnesses. The coexistence and interpenetration of distinct medical traditions with different cultural roots in the same medical community is called medical pluralism. This particularly we find with non-Western civilizations like India, China, and the Arab world, where they've had sophisticated medical systems for centuries. as these nations have begun to industrialize and incorporate aspects of Western medicine, it hasn't replaced these distinct medical traditions. Instead, it has supplemented them. So one example of this is Ayurvedic medicine. Indian Ayurvedic practitioners diagnose health problems by reading the pulse and mixing specific herbs together. And that exists hand in hand with Western medical traditions. Practitioners also use Sinhalese. This is refers to the people of Sri Lanka. They use Sinhalese medical ideas and medication or mediation of both Ayurveda and local Sinhala medicine. More recently, these practitioners have begun to include things like thermometers in standard Western medicines along with their herbal preparations. So we see an incorporation of standard, like what we consider standard Western medicine. In an increasingly globalized world, medical anthropologists emphasize that all medical systems are plural systems. These plural systems can be valid, important parts of solutions to global health problems. So one of the reasons why, for example, Asian populations have been able, particularly Eastern Asian populations, have been able to stem the spread of coronavirus with much more ease than the US is that both East Asia and the Middle East have had scares of coronaviruses well before this current outbreak. With SARS and MERS, right? There's already a cultural practice of wearing masks when you feel sick, as well as wearing masks just as a preventative measure. So you haven't had to predict or convince people to wear masks. Medical anthropologists play a role in understanding and preventing the spread of disease. This will include viral epidemics like HIV and Ebola. This includes our current coronavirus outbreak. So here, with thinking critically about the body, medical anthropologists have traditionally been involved in public health efforts to vaccinate children, to provide clean drinking water, and more recently to assist with combating AIDS and HIV. One of the most successful methods at preventing the spread of HIV in the US and Europe has been condom use, right? That's been less effective in sub-Saharan Africa, Haiti, and Southeast Asia. In Africa specifically, epidemiologists didn't recognize the pattern of transmission along trucking routes, and specifically then truck drivers engaging in unsafe sex practices with people along their route. Anthropologists were able to record people's ideas about HIV, their explanatory models, and specific information about the sexual practices of both women and men that help to bring to light these patterns. So without the work of medical anthropologists, we would be less successful. I mean, we can't just swoop in as Western aid organizations and say, we've got your solution. Here's what you're going to do to be healthy, right? So why would such public health efforts be a natural role for anthropologists rather than an anthropologist's involvement in clinical settings that include physicians and their patients in modern urban settings? Why do we have more of a role for medical anthropologists in public health in less developed countries, for example? Why don't we see the importance of medical anthropologists with respect to medicine in modern Western nations?